no need of introduction to Dr. Nagaragu sir, because he is the authority, as he said, he is the only authorized person in this topic from European authorities also. So we are very proud to have speaker like Dr. Nagaragu sir, and a very eminent figure in allergy and immunology in India, and he is also founder president of in this Pediatric Allergy and Immunology chapter of FIAP. So we welcome you, sir, and without wasting much time, we will start our topic, very interesting topic for discussion: food allergy in children. Thank you very much.
Please, can I
sir.
start?
Yes, sir. Please, sir.
Yes, sir. Please go ahead, sir.
I think thank you very much for the IAP Kolhapur to invited me to give a talk. I was supposed to be invited as a personal. I have to give a talk now actually, but because of COVID situation, it will become virtual. But it won't make any difference for you teaching wise. I think in this food allergy, I spoke several times, but I thought adding new and all, everyone must know about this. No, you know that food allergies are increasing. Everyone knows that. Whatever we see about 10 years back, I just go back, everyone thought about only respiratory allergies. At that time, nobody knows about food allergies in India. And there are a lot of confusion between food allergies and intolerance. Both are very mimic each other. A lot of patients of intolerance come to my clinic and tell, I have got food allergies, sir, please check. That's why the perceived food allergies are very high among the people. So how do you differentiate food allergy intolerance? We also talk. And food allergy is a complex one. It is very difficult to understand. A lot of people about and a lot of people misdiagnosis and mismanagement. They unnecessarily diagnosis, overdiagnosis, underdiagnosis, both will be there together, especially cow's milk, non-IgE mediated. A lot of people won't take it and take it as a lactose intolerance also, most of the people. Unnecessary avoidance of foods. A lot of people, I got a lot of people who come to me, I have got 40 foods allergy, I cannot eat this food, that food and all they will take. And daily food intake is challenging in families. What to give, what not to give, what we have to prepare to the child. Every day, what is going on? That is a big hassle for the families to think about the child. And psychological problems are increasing, especially IgE mediated and non-IgE. Both are very, very common. In India, more of a non-IgE is more common compared to IgE. Especially these two are there. Parents are very much worried. IgE, what if he eats outside? Small child go to school and eat and then fell down somewhere, and a chronic disease of non-IgE which is not resolving at all, especially younger child, and it worries to the families and causing a lot of financial burden also. And the main problem is not able to diagnose the non-IgE mediated food allergies leads to a lot of nutritional deficiencies. And if you don't diagnose itself, they will go for the anemia and other problems. So we need a proper identification and treatment required. You know that food adverse reactions are divided into immune-mediated, non-immune-mediated. Most of the people know about this, but still I want to tell you that non-immune-mediated, it won't come under allergist perspective. Immune-mediated, both IgE, non-IgE, now called as IgE and non-IgE mixed together, especially eosinophilic esophagitis, eosinophilic proctocolitis, all these eosinophilic syndromes is there. Gastrointestinal syndromes are come under mixed categories, and T cell is there. Food contact dermatitis comes under T cell this thing. IgE is the biggest thing. What is anaphylaxis and urticaria, angioedema, asthma, rhinitis all come under IgE. Whereas non-IgE mediated, non-immune mediated, a lot of people know about metabolic lactose intolerance, pharmacological caffeine and all, toxic one, and sulfites. These also can cause this thing. And rhomboid fish, those people already eat outside food and they'll come back with a diarrhea and other things. They think that it is a food allergy, but it is definitely non-immune mediated. What are the prevalence of food allergy? Whether you are seeing food allergy or not, the cow's milk allergy drastically increased. I'm telling you, for the past 15 years, I'm seeing this milk. Though we are doing, IAP is very active in doing promoting breastfeeding. Everyone promotes breastfeeding. Still, I don't know what is happening. Only thing I found in my practice, and also I found in literature also, saying that what is the mistake India is doing? First 3 days, as soon as LSCS is there or the normal vaginal delivery, when mother is, they think that mother not able to feed the baby and no milk is there, they give cow's milk for 3 to 4 days or formula pills, whatever maybe, both are same. That is the reason why it triggers cow's milk protein allergy in a lot of children. That is a thing I always tell them, that don't start first 3 days at all. First, that is that triggers, and when there is already immature gut, it's absorbed the cow's milk protein and causes a lot of things. Egg, of course, not many cases what you see in our practice, but definitely we get severe cases egg allergy, which are most of the times they may not come to you. Wheat is about 11, less than 1%. What happened? Wheat, younger the child, very young child, we see a lot of wheat allergies. And suddenly, when they go for the adolescent age, nowadays adult girls will get adolescent by 8 years, 9 years when they become minority. We see these girls are also and adult and children also going around 12 years of age. We can go fish becomes under 0.2% in children, 0.5 in adults. You can see shellfish less than 0.5 in children. These things are also. Can you able to switch mic, please? Be very disturbing. That's only I told before itself that this is the only thing problem entering, that they won't mute the mic. That is disturbs the speaker. You know that fish, shellfish, and nut allergies never overgo. Throughout the life, it will be there. That thing, and these are the things very less common in children and very common in adults, especially prawns is more seen in adolescent age group, and nut allergies also. But we are seeing lentil allergies are increasing in India. That is the one thing concern for us more. What is the difference between food allergy and intolerance? The food allergy is mainly small amount can trigger, and it occur within few minutes to hours, 2 hours it normally takes. And symptoms of fatigue area, I already told you, it is a life-threatening and happens every time. That is the biggest thing. Intolerance, when you go, I will tell you one example. When you go to some function, you feel like eating, lot of items are there, you take excess amount and full stomach, you will come, it is not digesting. I feel borgogmy, my abdomen is distended, something like that. They will say that that is the one thing what is called intolerance. You eat, you require large quantities of the food. Otherwise, it takes days also to develop. That's why you may not able to understand that thing. Abdominal pain, bloating sensation, to eliminate your diet only you can able to find. Where you can hear skin prick testing, specific IgE, oral challenge can able to help. And the risk of anaphylaxis, highest in food allergies. There is no risk of anaphylaxis in food intolerance. What is the difference between IgE and non-IgE food allergies? These are the two things we have to know. Non-IgE very difficult to understand, and IgE easy to, even a non-medical man can able to pick up. I got a food allergy. I eat in the food, I develop these problems, urticaria, angioedema, and difficulty in breathing, and they got a hypotension, shock, and anaphylaxis. That anyone can tell. But non-IgE mediated mainly involve GIT, mainly vomiting, and nausea, abdominal cramps, and diarrhea, and there may be colic and GERD in small children. This chronic diarrhea, all these things we'll find in non-IgE. And whereas the quantity required is very large in non-IgE mediated, in IgE mediated very, very mild. It takes its few seconds, same like it takes more than 2 hours, 2 days it takes. That's why it's very difficult to write. There is no life-threatening attacks. You have got a lot of life-threatening attacks. Here is type 1 type of IgE mediated. This is more of a type 4 T-cell mediated thing is there. And depending on system involvement, its manifestations will be there. Here is pallor may be there, tiredness may be there because of GI involvement. There is occult blood loss or maybe frank blood also sometimes more. Only by elimination, reintroduction, you can able to find out. Here, SPT and other things you can able to find out. There are a lot of phenotypes has come in food allergies also. This is the thing what you see in our practice. That is classical phenotypes, that intermittent phenotypes, what you call classical phenotypes, transient. They come, you see, in a very young age, like milk and wheat or egg, they overgrow after some time. Whereas the persistent fish and peanut and lentils and shellfish and all will be persistent long time. There is another one is called food dependent exercise-induced anaphylaxis. This is a new terminology has come. This is a lot of patients are coming in India also. We got 24 patients. Now recently we saw another 25 added. When you present in the EAACI, when we got a best paper award in all over the world. And food dependent exercise more common nowadays. You take the food, nothing will happen to you, but you do exercise or running, you may develop this problem because of threshold will go down, absorption will be increased, hyperemia is a cause for that. Another one is called NSAID dependent. So you take the food, nothing will happen to you. But you take along with that, you develop arthritis, or you got another pain, body pains or something, maybe something you have taken NSAIDs, aspirin or ibuprofen or diclofenac or something, whatever may be. That threshold will go down and you develop urticaria, angioedema and other things. But as usually this food you might have taken every day, nothing will happen, but you have taken NSAID, it will happen. This food you have taken every day, but exercise you are not done, that's why you don't develop. That's one of the things. Alcohol depend, that's only we used to see in a lot of our banquet also. A lot of cases I picked up, prawns and other things, people eat it and they take alcohol also. Prawns never cause, for that person, prawns never causes, but you had a alcohol and that decreases and you develop urticaria, angioedema, anaphylaxis. We saw a lot of patients of that thing. So these three things decreases the threshold of things. That is the one thing. What is intermittent? That is cross-reactive. You are not allergic to food at all, but you are allergic to pollen. That is the thing what happens. So many people are allergic to pollens. The pollen is cross-reacts with that. La banana cross-reacts, latex. Banana cross-reacts with the parthenium. These are the things what you can be able to do. And some food is cross-reactive to other food. And this milk, all milks are cross-reactive. You are thinking that cow's milk you are taken. I don't. I know you can take buffalo milk or goat milk, sheep milk, whatever may be. They cross-react to each other and you develop same symptoms. So that is called cross-reactive thing. But you are not originally, that thing is not, because of sharing of the protein. That is the reason why it causes. Aerolized. Now we are seeing a lot of aerolized type of food allergies in our practice. What is it? If somebody is boiling the milk, patient collapses with anaphylaxis. Somebody is boiling something. I am going to show you some more patients also. Aerolized one. And that causes wheat or something, whatever may be. Wafers itself, it can cause that thing. We can able to see that thing. If the pollen also, while coming, pollen also aerolized sensitization, and then cause the food you are taken cross reaction. That also. Alpha-gal syndrome because of beef or pork eating. This is one of the carbohydrate and delayed anaphylaxis we can call. It has never occurred in India. Up to now, no cases reported, but it's only northern portion of the USA they are diagnosed some few cases. You are sensitized but non-reactive. When I test a lot of patients, 40 people, 40 allergens positive, 20 allergen positive, everything is positive, but you are not reactive. Eating, nothing will happen. You cannot stop it. That everybody will be there. These are the types of phenotypes are there. You must be aware of these things. And you know that what is the commonest presentation of the food allergies in your practice? What we observed, that is anaphylaxis. 35 to 55% of the patients over the years it develops anaphylaxis, leading to anaphylaxis. That's why a lot of people observe. Another thing, what you see, 35% of the patients with atopic dermatitis, where exacerbation of atopic dermatitis by milk or egg, whatever prawn, whatever maybe you are taken fish, may exaggerate the atopic dermatitis. That's why never heals the atopic. How much amount of steroids you put or anything will not happen unless your stimulus will be removed. It's not going to. Another atopic dermatitis also exacerbates house dust mites. Urticaria with or without angioedema. These are 20% only. We think that very, very high, but most of them are present as acute, not as a chronic cause. Asthma is 5 to 6%. A lot of patients of mine, we got about some 40, 50 patients of food allergies present as asthma, mainly cow's milk protein allergy, prawns, or maybe so many cases we saw in our practice. Lintel also we saw in our practice. Chronic rhinitis is rare, and acute rhinitis may be there. Sudden running nose, sneezing, and congenital congestion, hyperemia, and all will be seen. Oral allergy syndrome abroad, there are a lot of pollen has got cross-reactive bitch pollen, and all this cross-reactive, the ragweed, all cross-reactive. In India, we don't see much of things other than even in Himalayas areas where bitch pollen is very common. There is a cross-reactivity there among the fruits and other things. When you eat this food, there is like a Hanuman face or Anjaneya face or something like that you develop that is not much known in our country up to now. This child is from OPD, has come to me with urticaria angioedema, and he is taking antihistamines and oral steroid prescribed each attack 2 to 3 times, and he had last attack, he's developed difficulty in breathing also. He taken to local hospital, they given IV steroids, become all right. They came to us for the workup, and we found we did normal what is supposed to be done for I know that child is sick and is angioedema. We did some food stuff. We found out that egg is very, very high, and that he taken the egg from the cake, what that is causing for, because very, very severe. Even egg boiling also I saw that vapors itself, patients will go into anaphylaxis. This child stopped the egg and child is doing very well. We got a lot of patients along with the egg, with the dust mite, we give immunotherapy, egg will also improve also. And this 4-year-old child is a known case of atopic dermatitis since the age of 4 months. He has got mother saw that he has developed rash and angioedema after taking cow's milk products, and she tried with soya milk also because lactose-free diet, and formula feeds also they tried, and yogurt also used, but she developed again other episodes also. Mother stopped all these products, and at 9 months he developed arterial rash angioedema after taking egg also. And family function, somebody has given the infant lentil soup that we call sambar in our area. In English, I don't write sambar, actually lentil soup is given. Developed severe urticaria angioedema. Parents are very much worried about that and he's got developed poor weight because mother has stopped all the things. Milk is not stopped, soya is stopped, and egg also stopped. All these things stopped. That's why they came with poor weight, IgE, total IgE levels of 1 high. We did the test in our hospital. We do commercial extract with the fresh extract. Whenever there is a fresh extract, we develop our own fresh extract and we do the skin prick test. When we develop, then we do, whenever there is a commercial extract to fresh extract has more SPT wheel, then indicate that will be skin prick test, indicate that it's got a severe disease. And SPT is very high for cow's milk, and specific IgE by immunocap more than 100. Casein, we are the only people who are doing component resolved diagnosis in India. Nobody, even big hospital, they won't do. Only one place where you do. Casein shows 67.7. That indicates he's got a severe allergy. Lactol will be very less. Nothing to worry about. He eats labile, and this is heat resistant. That's why this fellow cannot eat milk at all. Egg also, we did this 10 into 12, and egg is also 100, more than 100. Ovum mucoid, we got a thing that is 76, very, very high, and that's why this also cannot eat. Soya milk, that is not much sensitive, and even with specific IgE, not much. And lentil, you see that very, very high, though commercial extract is less, but fresh it is come to 10 millimeter. That's why I went into that thing. And lentil, because in India we don't have separate to do, only masoor dal is there, but not effective. Chickpea is there, they do, but we got whole lentil is available. We did it, and we found that this patient is allergic. That now we stopped all these 3 things. Soybean continued for the child. This child, Sam Sudhar, came to the grandparents' place, suddenly developed severe itching followed by flushing, congenital hyperemia, and edema of lips. All my personal patients only. And arterial rash wheeze after he exposed to the vapors of boiling chickpea in the kitchen. He went to the chickpea inside the kitchen. He came to mother and father knows about his lentil allergy, but he's gone to the grandmother's place. That's why he developed everything. And yes, he had a history of 3 months back taking the sambar. He developed this problem, and that's why And he had got several episodes with chickpea also he developed because all the lentils cross react each other. Please understand that one dal is allergy, most of the dals will be allergy for that. And they stop lentil chickpea intake at the time. Since then, stopped eating all these things. But he came to us he has got allergic rhinoconjunctivitis responding to INS also. He came to us, we investigated 1,230 is the total IgE levels are very high, and we did with boiled and raw chick with the chickpea and yellow dal. We did that thing. Both are very positive. You see that, and skin prick test is positive both, and the lentil also 28.4 and chickpea is 87 points. Chickpea is very high. He's got dust mite mild. The positive is there. So this child challenge could not be done. He has got history of anaphylaxis. We don't do challenge test for the anaphylaxis. So my friends, what I am telling is that there is lentil allergies also increasing in India. That patient has actually from one of my friends' grandchild actually was that child. 14-year-old child boy, he is also one of the doctor's child, recurrent attacks of wheeze and sneezing for nasal block for 7 years. But these fellows went and is taking INS and all, whatever supposed to be taken, MDI and all. Patient is not willing to take MDI at 14 years and all, very shy to take MDA and INS and all. The doctor, they want to go to the some other consultant, they want to know about allergy testing. They went to the SPT, some lab, so the dust mite, house dust, pollen, apple, I got that thing, but I don't want to show that thing because it looks very awkward to project some labs who is doing skin prick test. Orange, wheat, fish, prawns, egg, all lentils, 40 items test positive in 62. And that fellow was told to stop all foods. He stopped foods, which is positive, but there is no improvement. Nutritional deficiency started, cheilitis started, anemia started, all problem losing weight. He saw the advertisement in a local newspaper. This actually happened. A lot of people know about the local newspaper. I don't want to tell. Then he went to blood test. There, instead of 42, he developed 35 food items. So there they did even urology, this fellow was got, and most of them are different from SPT report, that skin prick test. They are very confused. Both are doctors only, and rushed to me. And we did skin prick test and immunocap. Only DF and DP is only positive. Nothing else is there. My dear friends, why I'm telling you is these bogus tests are going on in India. Unless use the standardized allergens, don't do allergy test. One. And only immunocap is the only standardized blood test, specific IgE test to do. Other tests are bogus, and the Imulite is not much available, and ICAR is not much available in India. Other than these two, no, nothing is available. All other bogusly they are doing, and don't do any test at all. And they assure the patient advice for immunotherapy also, but they didn't come back. This girl, Rajarashmi, 12-year-old girl, has come to anaphylaxis, recurrent anaphylaxis. One attack anaphylaxis, admitted, is treated with adrenaline. There is history of angioedema, urticaria, again and again. Research days to adrenaline and refer to us. And 2 weeks, we won't do SPT or any test. Send back the patient. After 2 weeks, they came. We did skip test, and gluten is very positive. See here to here. Severe gluten positive, and also there is a wheat also positive here. And specifically IgE gluten is more than 100. Wheat is about 9.2 only. Gluten, wheat are both things not important. Gluten is a germinal portion, third portion of that thing is gluten. And what is history we take that this girl used to go run after taking breakfast. After run the breakfast, and patient, she develops into this type of problem, go to the other hospital. Food dependent exercise into anaphylaxis, we suspected gluten SPT. I bought it from when I went to Germany for 3 months training. Long back, I bought the gluten. Normally, I give to gluten to all my students also. They are also doing tests. At that time, the dermatologist asked me to do the one of the study for the EAACI study. I did it. Omega-5 gliadin is very positive in these patients, and diagnosed omega-5 gliadin is one of the things is that thing, and is a marker for food dependent exercise anaphylaxis. This is diagnosed food dependent exercise anaphylaxis. My dear friends, please see that thing. You have to be very careful, all of the things, and you have to understand that. What are the symptoms of this thing is happened? There is a lot of things are there. Whatever I told you, all the things are here, is there. And there is food dependent. Food itself can cause anaphylaxis. Food dependent exercise anaphylaxis, both. All anaphylaxis nowadays, I took detailed history. A lot of things come with either food or food dependent exercise, or with the drugs. This is coming. Non-IgE mediated, I told you, cutaneous is there, exacerbation actually, contact dermatitis, and all these things. GRD, this is one of the things, and colic, infantile colic. You stop the milk, they will become all right, cow's milk, especially infantile in colic, we used to call previously. Recurrent abdominal pain nowadays, you do the recurrent abdominal is so common, and do the ultrasound, we will find non-specific mesenteric lymphadenitis. You think it is a mesenteric lymphadenitis. What is the cause? Non-specific. A lot of people come with me, ATT and all, not reduced and all. We find out some food allergy, mild food allergy is going on, which is not noticed by things. And constipation, perianal redness, food aversion, blood and mucus in the stool. So many things are going on in this type. Failure to thrive, tiredness, failure, and all these things will be there. This girl, 2-year-old girl with recurrent diarrhea for 18 months duration, is 4 to 5 episodes of loose stool for 18 months without mucus or blood. He lost 4 kg. She lost 4 kg. He lost 4 kgs for the past 4 months. There are dull aching, abdominal pain, knocked adrenaline practice also, and no history of atopy in the family. Treated with multiple antibiotic, herbal medicine also they are taken, and investigation shows that anemic. We are not mentioned here, and there is a IgL slightly increased fecal calprotectin. This patient is from Apollo. We got fecal calprotectin also available. We did colonoscopy with multiple biopsy taken. There is hypertrophied lymphoid tissue is present here, and increased eosinophilic infiltration. More than 50% of the eosinophils are there in the lamina propria. Short courses of prednisolone given, diarrhea reduced, eosinophilic colitis is diagnosed. And mother was told history. We asked at that time. She gives 2 glasses of milk every day. That is the thing. We stopped the milk. Child has improved very well. Milk diary maintained and stopped very well. And child is improved with hematinics. This boy has come to us. There are a lot of, we got 4 patients of this thing. Only this is another case of that. 2-month-old child come with profuse vomiting diarrhea of 1 month duration. We admitted several times. He has got LSCS, formula feed started on first day, but they are giving breastfeeding also. But grandmother always gives 2 or 3 times whenever child cries. She will give formula feeds or soya bean tried, soya also causing. He was admitted in the hospital, given IV fluids. Child has improved drastically. Every time he dehydrated and metabolic acidosis. Then they referred to us, and he was treated as sepsis, as WBC CRPs. WBC very high, CRP levels are very high, and is diagnosed as a PIPS, that food protein dependent enterocolitis syndrome, and stopped milk formulas and started on ask the patient to breastfeed only. We didn't steal, and grandmother off and on comes, and child used to get admission off and on. How many times they are not listening? Then we started amino acid formula whenever mother wants to give 1 or 2 times. Non-IgE mediated presented a food protein enterocolitis syndrome, which is cell mediated, and this is the one thing I already told you. Protein induced proctocolitis, diarrhea is the one thing. Blood in the stools will be there. They presented with very anemic but patient well thriving child. Protein enteropathy, and patient abdominal distance, dysphasia, and failure to thrive. Extra-intestinal manifestations also may be there. Allergic eosinophilic gastroenteritis, we used to see a lot, what I told you already. And peripheral eosinophilia may be there. Vomiting, the failure to thrive will be there in this patient, what we saw our patient. And eosinophilic esophagitis is coming up in India. Otherwise, it's not much common in India. Food impaction, you feel like something here, that is difficulty in feeding and all we can see in these patients. How to diagnose food allergies? Food allergies are diagnosed by focused food history. That is a very important. What happened when you give? How much you give? How long you give? And what happened? Sequence of events you have to ask. What is the age of when you started? Type of symptoms is there. How common. What when the reaction occurred, when you stop the thing, improvement is there. When reoccurring patient has come back again, all these things is really important. And family history, personal history, has got any atopic dermatitis. All these things you have to think about. Exercise before, I already told you. Stress, NSAID, all these cross-reactive inhalants, allergens, all these things has to be inquired on this. Physical examination, not much useful except atopic dermatitis signs are there or any wheezing is there, and water law, check for the signs of dehydration, wrongly written, and rule out other causes. You have to do nutrition status, you have to see. Investigations, food diary is very, very useful. You have to maintain a food diary if you are in confusion. IgE, non-IgE especially. This IgE also sometimes confusing so much. Patients will give several food, milk, egg and wheat, all together they will give. And skin prick test helpful you specific IgE by immunocap component resolved diagnosis. This is a skin prick test, what you do, and positive predictive value is 50%, whereas negative predictive value is 9%, 90% only. We can do prick to prick test, what you are seeing, banana, a lot of patients come with banana allergy, then we can show that prick it and do it also, we can do it. Intradermal test is false positive, don't do it all. Even now in the era of 21st century, a lot of people doing intradermal test and causing severe side effects and all. Oh, then how to diagnose SPT positive or particular food, or there is a IgE mediated, specific IgE positive, or both may be positive with the typical history, and elimination positive and reintroduction causes increase symptoms reappear is called as IgE mediated food allergy. This child has come from nearby place. This child come together with the again arterial rashes. This thing after consuming milk, parents wants to tell that we want to know whether child is overgrown or not. Already proved one. Then it was 26.5, and we asked them to continue. Is that at that time I don't have casein, I don't do at that time. It is old and old patients, and we don't have facilities at that time to do components, and that's why we asked them to come repeatedly, and after some time it's become normal and it's coming down slowly, and we told that you are overgrown. So my friends, what I want to tell you, serial checking of the food allergies by doing the specific IgE, very, very useful. And some patients may respond even low when the levels are very low. Even here itself, some baked milk products like cake and the biscuits and all these things can able to help the patients also, so that we need not to do other challenges. This is another patient of mine that from Andhra Pradesh, they came to us with, they want to know urticaria and angioedema, and they got lintel, wheat, and cow's milk. All these things they are giving at that time. We did it egg only positive, 100 milligrams. And we did every serially, we did for 1 year. We found that everything is safe, 100, and is not coming. So we told that we don't want to do at that time challenge test whether you overgone, you have to wait until child is 6 years old. Otherwise, we have to go for the immunotherapy or completely avoid it, oral immunotherapy. My dear friends, is only chin prick test may not know about the actual how much quantity is increasing or not, but definitely immunocap helps you. Is the progressive or not? It is increasing. It indicate the severity of the disease. We can able to make out. Serum specific IgE testing, very, very useful. That is a immunocap. What I told you is, and definitely 0.35 always you take it as clinical significant, but all the time may not be significant. Patients exposure, we take it more than 5 for the milk, we take it significance. And always you must think about cross reactivity and whether it is food induced or not. We can able to find out by immunocap technique that there is no role of IgG testing. A lot of people come with me and say that IgG4 testing for the patients, for that if you eat food, automatically IgG will develop. IgE will develop because of switching mechanism is happening. That's why it will develop. Unnecessarily don't do food, don't do IgG at all. All foods positive will come. This child is mainly important. 2-year-old child come with urticaria rashes for past 6 months. Yes, he came to us saying that he's taking egg, milk, and yogurt and some lentils. We tested. He's got positive to lentil to negative, and egg is negative, and milk is 27%. When I will overgrow, we got components are there at that time for me, and then I did component, lactol 3.8 is very high only, but it is heat level, boiled. Most of the children drink only boiled milk only. That's why I didn't boil it. And casein is 12.5, heat stable, and I told the 12 point is very high. You have to wait for long time to whether child will overgrow or not. We have to wait and order for the frequent follow-up is needed. We told them. Component resolves helps you diagnosis in that thing, whether what is the trigger, whether it's a cross-reactive or is accurate diagnosis, we can able to make it, whether it's asymptomatic type or is local type or systemic type also we can able to make it out. If it is sensitized to ARA2 or casein, whatever may be, ARA2 indicates peanut. In the peanut in foreign countries, it is indicate that he will get 100% anaphylaxis. That's why you have to prescribe the EpiPen for them. And by doing this thing, whether you require oral challenges or not, we can go serially, we can able to do it. And persistence of allergy or not, we can make out. Example is casein. Casein high levels persisting means it is highly persisting. And also we can have a patient who come to me all the time, I am allergy. I did for component resolve, we didn't find anything. We did a ISAC also, we didn't find 18,000 wasted. Then we asked her, what is the thing? Everything we did, nothing is there. What is it? You are telling itching, anaphylaxis, nothing is there. Whenever come to us, no anaphylaxis. She said I admitted 3 times at all. Then we had to father-in-law, mother-in-law, quarrel as actually she is acting like that. Food dependent exercise, gluten you can able to find out, or other types also you can find out. Microarrays, nowadays I told you ISAC, that is called immunosolid allergen chip. You put 20 micro ml of the 30 micro ml of the whatever one prick, you can put it the drops, you can able to find out 112 components from 51 allergens, you can able to find out immediately. Another one is called Alex Explorer. It is not available in India at present, it is going to come to shortly. Both are not available, of course. And here you have to do 282 reagents, and from 156 allergens you can able to find out immediately by putting 1 drop. These are going to come in, it will be a boon for the pediatrician or for the allergist. What are the investigation needed for the non-IgE mediated? Non-IgE mediated is that elimination test is very important. You stop the food for 2 to 4 weeks minimum and reintroduction after 4 weeks, same food and same symptoms must start. And then if you suspect a case of only eosinophilic gastroenteropathies, then you have to do endoscopy and biopsy. You can see the histopathology. When you find eosinophils more than 20 HPF, definitely we need a good pathologist. I'm telling you, that is the very thing we can able to find out. Oral challenges nobody is doing. When you want to find out, we can do it. Otherwise, whether develop tolerance, we can able to find out. Otherwise, nobody is doing this procedure nowadays. This is IgE, I already told you, is not much important for you. And coming to the management wise, I will tell you that thing, management, avoidance of the allergy, easy to talk. This animal is telling, don't put me, I am allergic to this. So wheat, I don't like to wheat. Wheat is allergic. That is the thing. What is gluten allergy is in abroad. People are using non-gluten food and causing a lot of nutritional deficiency unnecessarily for ADHD and all these things, autism and all. People are in migraine. All these things people are using. So food labeling and checking is very important. Dietitian referral. So that we have mild symptoms. You can manage with antihistaminics. And anaphylaxis, adrenaline steroids. You have to give steroids, all patients anaphylaxis, because second, next time won't develop protracted anaphylaxis, or second biphasic anaphylaxis won't develop at all. That is one. What we did is, and we want to do parent-patient education, caretaker education also very important. Who is looking after the kid, we don't know. And we are loading this adrenaline in a cc, 1 cc syringe, we load it 0.15 for children, and adults we see 0.3 and covered with the black paper and put it in spectral box and give to the child. Light sensitive is very common for the adrenaline to damage, whereas heat sensitive, heat resistant it is. So don't expose to light. When you want, even with the cloths you can able to give. We save a lot of patients with mastocytosis, and we are giving to all patients of immunotherapy, going to and taking to the other doctors we are giving. We do a lot of immunotherapies in our practice. Nutrition counseling is very important, and this when you are stopping all these things, anything you have to see. All people will think about only calcium and phosphorus and vitamin D. Please think about vitamin A, vitamin D, and all these things. When you stop certain food, you have to know about what you want to replace it. Also very important. Probiotics. Lot of probiotic people are trying, but there is no role of probiotics at all. And Ramnos GG tried that thing, but no consensus has such a statement, or by uh, any societies are not giving at all. But there are a lot of studies like this study, so maternal carriage can able to help the child and all, but still we have to wait for the results. This is the case scenario: 5-year-old child with a recurrent wheeze and sneezing for 8 months. He has got angioedema, went to anaphylaxis after taking milk, and even uncle, father, and all they there. When they find out, I will tell you, milk is 21.4 only, not much, but his only tolerates 1.5 ml. Parents are very much worried. Both mother is working as a pilot and father is working in a bank, but they are one in Hyderabad, another is in Chennai. They are worried. Child is going to school. What to do? We started a oral immunotherapy for the child, and child is doing extremely well. In fact, this child is from actually from Bengal, actually West Bengal. This child has come with a recurrent attack, cold, cough, wheezing, urticaria rash, angioedema, and had anaphylaxis and all, and vomiting and all. They say that it is definitely milk and even difficulty in breathing when you see that thing. Patients, as we did this thing, more than milk is more than 100 micro. This thing, DF and DP is negative. So the cause of the anaphylaxis and breathing difficulty, we thought is IgE mediated, and patients are not willing to for sublingual SOTI, that is oral immunotherapy, and we started sublingual immunotherapy. They are regularly taking sublingual immunotherapy from actually the patient is from Asansol, I think. And we started, you see that child has grown up from here to here. Now you see more than 100 there, now it is 11.5. Now at that time there is no casein in my place, and now we did casein, lactal women, all as casein is only 8.2. Child is improving very well. Now she's taking bread, cookies, other baked products. I asked them to take breakfast. Only thing, she's not able to drink the milk only, that is one thing. I thought after some time she will be very well. How do you approach this child? Nowadays, the consensus has changed a lot. Anaphylaxis, you wait for 6 to 12 months. If persisting, do the immunotherapy. Otherwise, war goes well and good. Whereas other than anaphylaxis, allergen avoidance, you did for 3 to 6 months. Persisting, go for immunotherapy. That is the common thing. If you improve, well and good. So allergen immunotherapy become very popular. Now sublingual immunotherapy, oral immunotherapy, a lot of people are doing all over the abroad, and we got our own protocols, and we got around 24, 25 cases of, we recently presented European Academy also, and there is now recently approved Falforazia for the peanut allergy oral immunotherapy. Directly patient can take one thing, 10,000 rupees it costs, and each one I'm talking. Epicutaneous immunotherapy, you put the patch on that patient and patient improves drastically, and it's very promising for peanut allergies and also cow's milk allergy, and a lot of people started doing. And oral immunotherapy for egg, wheat, and milk, only 3 is at present, and no peanut immunotherapy for more epicutaneous immunotherapy for peanut where people are doing. Nowadays, a lot of people, because of oral immunotherapy, cause a lot of side effects, they are giving omajolam for 2-3 doses, and then we have got a lot of patients. All my patients has got a lot of complications. We give a lot of times, even adrenaline also. How to monitor? Growth monitoring is very, very important. We call them all the things. Don't stop wherever you go. The people who go to the dermatologist for automatism, stop all these things. They go to the thing, urticaria, stop all foods. That's not the correct. Unless you do the test, you cannot stop it. Growth monitoring is very, very essential. Nutritional adequacy is required. Adherence to elimination diet is more important. Lifestyle, you have to explain the lifestyle. Especially adolescents, they're fond of the parties, going to hotels and all. Very tough to manage psychological aspects unless you put it in the patients, and their mother is very much worried. I got one patient, we did SOTI, we got the video mother has sent and sent so much. One of the appreciation letter to me, my child is able to drink 400 ml of milk, where even mother eats food and washes the hands and touches the child went into anaphylaxis. That is the situation. Child has improved drastically. Psychological things we have to think about. The parents, whole family will be affected. Food allergies. Factor favoring the resolution, non-IgE mediated faster. By 2 years, most of them will resolve. If there is no comorbidity, resolve very faster. Lower serum specific IgE resolve very faster. Smaller skin prick test, they will improve, whereas the bigger thing may not improve. And high levels may not improve at all. And IgE takes about 57% only, they will be overgrown as per the Euro-Prevalent. But I feel that 90% overgrow by whatever I told you, milk and egg and wheat will overgrow by 6 years of age. Downtrend of specific IgE, one is coming down, definitely they will increase that. Even after accidentally somebody has taken, they themselves are, I am able to tolerate now. That means even IgE, very high levels, but child is maybe able to tolerate because of threshold levels has increased to the child. What is natural history? By 6 years, by 10 years, most of them are overgrown. And soybeans overgrow, egg will be overgrown, wheat will be overgrown. Only these things will persist for that. And long time you have to persist all these things going on. Once you develop this thing, especially peanut, tree nut, and fish and shellfish, and all these things never overgo at all. Prevention, breastfeeding is the best for your child, and continue breastfeeding as much as possible. This is a olden guidelines. I'll skip it and I'll go to the next one. I think somewhere it's missing. So what happened? They say that avoid high risk situations like picnic and gala. Labeling of the ingredients is a must. In India is very tough. Roadside don't eat at all. Whatever food allergy patient must eat in the house only. And establish allergy anaphylaxis food network. We are trying our level best, but still it is not able to happen to us. This is a LEAF study. Wonderful study, I think, learning about early introduction of peanut allergy. That is LEAP study, 13 months, 60 months, and then after 72 months is going on. LEAP 144 months is going on. One is called LEAP study and LEAP-1 study. This is over up to that. Now it is continuing. LEAP trio is going on. What they found it, that simply I will tell you, by giving introduction of the peanut at 4 months of age to the child who has got family of allergies or eczema is there, suspected food allergy, egg allergy or something, whatever may be. We are thinking that type of patients, you give milk, introduction of peanut, slowly introduce very early. I think that patients who are introduced, they may over 80% of people not developing peanut allergy compared to people who are already avoided and started peanuts at 2 years of age. That's the study at all. And this is another study called EAT study. And this, what they did is that by giving peanut and egg and sesame things, and also wheat and milk, egg, all these things given to the child at 4 months of age for all the children, general population, they found out the peanut and egg is coming down. Those who are not taken, but there is no difference between other foods, and they saw that it is not much used for LEAF study, only useful for the peanut, and they found out the egg also useful. Now, what is the recommendation is come, is latest recommendation is that now American Academy of Pediatrics and American Academy of Allergy and Clinical Immunology, European guidelines, they recommend that peanuts to be started 4 to 11 months of age. Strong recommendation, high quality of evidence is there. Cooked egg, only cooked egg, no unboiled egg don't give. 4 to 6 months of age. Previously, we used to give 1 year of age, and milk 1 year of age. After 1 year only we used to give. Now we can introduce it very early. Wheat is always less than 6 months. They recommended, but it's a weak recommendation only. And fish to be introduced after 6 months, 9 months only. Other thing they are not mentioned at all. These are one of the new guidelines has come, but I feel that WHO and Indian Academy of Pediatrics, you must follow 6 months, you must give. Afterwards, only whatever you want to start, you can do it. Peanut allergy is extremely rare. I have not seen a single peanut in my 27 years of allergy practice at all. A lot of patients come with me, I got peanut, but when I tested for, nothing will be there. There may be cross reaction to the lentils may be there. That is one thing what we find, but we didn't find anything at all. My dear friends, another few minutes. I think a lot of people may not know hidden allergens. They think, you think that milk is allergic. Even if you boil in this milk, one of my patients, child has kissed and child went into anaphylaxis after taking the milk and washed them also. And in the same vessel you cooked and then again cooked in the same vessel also will happen. And milk, you take the example, casein, curds, ghee, everywhere will be there. And lactalbumin, we have to see the products. Products are there, so many products. Casein is contained so many products. You have to see that thing, whether which product is there. No labeling is not there. How can you think about this thing? Allergic food ingredients, non-food substances. That is also another problem. Think about that thing. This non-stick, anti-stick, we are going to rub. Everyone using that contain casein. Ladies using a lot of this stick that contains casein. How can cosmetic? Milk is there, nut oils are there, and your asthma inhaler, soya milk. Most of the milk allergy patients has got soya is cross-reactive, 30% will be there. Dry powder inhalers, lactose content, lactose is there. So how can you avoid it? These are the problem in India. We have to identify it. What are we developed two things. One is for milk. What we see, 257 cases we got milk allergy. We are going to publish shortly. And we got about gluten allergy. We are coming out with 28 patients of gluten allergy, food-dependent exercise. We have a chart, what to eat, what not to eat. We give to the patients. My dear friends, another thing, my favorite thing, is that coloring agent, red color, yellow color. Children like very much jellies and all. These are all lightly. We think that food allergy, we are thinking that I have a patient who come that I have a patient fixed food eruption here. 12-year-old girl, when we go to school, people will laugh at her. And she refused to go to school at all. And then why it is occurring? Food, there is not giving any fixed drug eruption also, because it is due to one of the dal we found out. And parents not accepted. They are telling dal is the cause. But we found out yellow coloring agent mixed in the dal is the cause for that. And parents afterwards, they convinced it. High histamine content foods. This is a very important thing. A lot of people think about a lot of things. This chocolate, high histamine content. A lot of people think I eat chocolate. Mother is always correct. I ate banana. I ate pizza, Lay's, chips. This fellow yesterday, Lay's and chips. And alcohol, red wine contents, all nuts contains diamine oxidase inhibitors are there. Coming to histamine tolerance. Intolerance is very genetic one, and also by the food, what you call it as certain drugs and some food also increases. Why this people? Very rare disorder, 1% of population will happen. Often mistaken as a food allergies. I took that food, immediately I developed this, but it is actually histamine levels are very high. You control it. What happened is that there is decrease in effectiveness of diamine oxidase, degradation of the histamine. That's why it may be acquired or genetic. That is called a DAO, diamine oxidase. Very, very my favorite thing. In fact, there is another enzyme is also that histamine and methyl transferase, which also break down histamine within the cell also. There is two enzymes, but it is not much common. This is very common now when compared to two. Don't say that very common. This is only compared to diamine oxidase. There are a lot of drugs which has got diamine oxidase, reduces diamine oxidase. There are certain foods which increase the diamine oxidase also. You must know about that. This NSAID is used commonly, and ATT drugs are there. Theophylline is there. Alcohol also reduces, and that's why also this happens. Check how do you diagnose. Food diaries helps you plot and which color. Then we can say that, oh, this I have taken that thing. What happened? And DAO levels not available in India. The diamine oxidase levels is available in the thing. We can able to check the DAO levels also. We can able to find out how to treat it. There are in abroad DAO supplements available in USA, but not available in India. And whenever patient is eating that food, this type of certain foods has got a lot of DAO inhibitors. Like banana has got DAO inhibitor. So when you want to eat banana, take one supplement of DAO and eat banana. Nothing will happen. That's one thing. Or you take antihistamine steroids may help. In summary, I think what is the thing is food allergies are increasing, and prompt identification is important. And avoidance is the only modality available at present. parental counseling is very important. Very, very important. Parents are very, very troublesome. I'm telling you. They roam around. They take homeopathy, allopathy, all the things roam around and come back to you. And with a lot of problems. I saw one of the lady died. Afterwards, we came to know that they died of. I told them, this is anaphylaxis, we can do something for you, but they're not listening. And nutrition to be looked after during the avoidance of particular food. Otherwise, you say that very easy, stop. That's not correct. Nutrition imbalance will occur. Oral sublingual immunotherapy, both are promising, and we can use it if unavoidable things, certain things which have certain foods has got a lot of in different parts of the foods or different non-food containing substances are there. Their immunotherapy is a better chance, especially bigger children and all. And adderall is the drug of choice for anaphylactic reaction, especially in severe cases. I think it's the time for us to act together, all of us to be together. We need a lot of research in food allergies, and we have to produce so many data from our India. And then this is my book. We written extensively on food allergies and cow's milk protein allergies. We are written. We can go through this thing. It is available in the market. And thank you very much for giving me. And once upon a time, I was doing all namaste. Now everybody is doing same namaste. And I was wearing the mask when I go outside. Now everybody is wearing the mask. Thank you very much for giving me the opportunity.
Yeah. Thank you very much, sir, for such a lucid, informative, and very authentic talk over this not common topic for pediatricians, but it's a very interesting facts came up in your talk. Very informative talk. I would like to appeal all participants to have discussion over this topic. Any queries they can raise, sir will be. Sir, we request you to answer those queries.
Yeah, especially I asked about the Dr. Suhas Kulkarni sir. He want to ask some questions. He raised his hand. Suhas Kulkarni sir, please go ahead.
Yes. Thank you very much, sir, for this excellent talk. And we have a mix of people. So I will ask few simple questions initially, because as you said, a lot of people are sending a lot of panels about food and they are not aware that you have to take history. So what is the difference between atopy and allergy actually, Miss? How do you find out that this is sensitization?
Atopy is the genetic tendency of development of IgE mediated. That is called as atopy. Allergy is an hypersensitive reaction to the food or whatever may be, aeroallergen, whatever may be, which IgE mediated one. That is one hypersensitive, which normally when you go to in your body, nothing will happen. For any other person who has got, reacts very fast. A lot of people think allergy is the immunity is less. Actually, the immunity, more immunity, hyperreactive immunity is the more common for this. I think simply because a lot of questions has come my way.
Yes, it means that only if you send a blood test and it is not correlating with the history, the patient need not avoid that food, particular food which is taking.
I feel that one thing I am telling you, you ask the food whatever suspected. There is no panel at all. You make your own panel. I am telling you, I have a patient who has come 52-year-old man. He is a Brahmin. In South India, Brahmins won't take non-veg at all. And somebody has written food allergy panel. That fellow did chicken positive has come. Wife and the boy both are quarreled, unnecessarily creating problem. I told that it is wrong information. Then only they both are. Highly orthodox families. Unnecessarily, why you want to? You have to take a good history. Spend some time with the patient, and whatever eating, suspected food only you do. But positive indicates only sensitization. When a patient themselves saying, "Sir, I am eating, nothing will happen to me," then don't tell that 40 foods to be stopped and all. Nutritionally, imbalance will occur. That is one thing what I want to tell you. Next.
Yes, the second thing, I had a patient of oral allergy syndrome. So this is few months back. So I tested the patient for then I took the history. Then whenever, so it came for the green gram, that is tur dal, it came positive as well as for mugwort. So, but I read the literature, it is pollens only they have said. So how to approach? Because I asked her to stop the green.
Mugwort is a pollen allergy. If you do the immunotherapy for the mugwort or control the mugwort exposure, automatically you can take green gram. Nothing will happen to you. There is definitely mugwort has got cross-react with some of the dolls is there already. That is one thing. But one thing I want to tell you is that if you want to do, see, all pediatricians in India cannot do SPT, correct or not? Only trained people only can able to do. So what I advise the people is that first advice I will tell you, use only immunocap, immunocap, immunocap. I am not a brand ambassador for immunocap until Immunolite or some other brands are available. Very good one, but it may be costly. But instead of telling you whole panel for 20,000 rupees, you can do 2 tests, which is cost about 2,000 rupees. Why you want to waste patients' money? That's only I will tell you that don't do unnecessarily useless tests. Any good test, nobody will advertise. Any good doctor never advertise. That is only one concept I always tell them. Immunocap is the best thing, and you can do immunocap technique. People will better be able to do. Other techniques not available in India at present, and we have to wait for some more things what is going to come. A lot of people asking me. Some of the people respond me from abroad. There are some companies going to come after Allergo Pharma has left the India. There are 2-3 pharmacies planning to come to India. I think it is not far away. Once COVID is gone out, we can see very good standardized allergens for skin prick test or immunotherapy is going to be available in India. It is a good sign for us.
So we send the specific IgE test even though we do skin prick testing?
I think what I see is that in food allergy, specific IgE has got good role to play. Why I want to tell you is that what is the quantities you can know. Skin prick test quantity may not. The size of the wheal is not correlated to the severity of the disease. Whereas specific IgE, if more than 100, that is the severity of the disease. And also serial testing, it can help you whether patient is overgrowing the allergies or not. It has got a patient will get some confidence that thing. That's why otherwise SPT is gold standard. What you told.
Okay. So we get a lot of cases of chronic urticaria, and it is very difficult to find because they are not coming immediately. Means patient will come to the OPD after some time, or development of the urticaria 1 day or 6 hours or 10 hours. So how to find which food? Again, without history, again, do we send, because in children, sometimes the history taking about food allergy is very difficult, around 1 year or 2-year-old child coming with a chronic urticaria. So how to proceed about that?
Recurrent urticaria in children, recurrent acute urticaria, there is a chance of food allergies. But chronic urticaria daily persisting for more than 6 weeks, food is not the cause for that. Most of them are spontaneous urticarias, is very common. Spontaneous urticaria again divided into idiopathic and autoimmune. Autoimmune, there is cause available. Food intolerance may be one of the things now automatically coming. Anybody says that I took this food and I don't, 1 minute, hold on. Because there is the battery is going down. Yeah. What I am telling you is, whenever it says that I eaten food, you have to ask for whether coloring agent, preservative, and check it, that one. I put you recently one food, I found out that patients, that additives, whatever preservative, whatever coloring agent we found out, yellow coloring agent from that. So it is very important in a chronic urticaria patient, especially says that I took the food, and you are telling that you did it, specific IgE, maybe wrongly also will come positive or negative. But if you do the coloring agent or preservative, whatever may be positive, and you can give that coloring agents or that something, whatever maybe as a food challenge, he develops some symptoms, definitely it will be useful for that. Otherwise, I feel that spontaneous urticaria causing for food alone, chronic, is very rare. Whereas recurrent acute urticaria, food is the main, one of the cause for the infections. After rule out infections, that is one thing is what they come.
How to send for colors, testing colors, as you are saying, we have to send blood sample or something?
No blood samples. There is no blood samples available in India as per, but foreign countries is there. What we do is that prick to prick test, I told you, you take the food coloring agent, some problem is there. 1 minute. Yeah. I think what we do is that we take the coloring agent and we dilute it in several dilution, serial dilutions. I do skin prick test with the dilution that is called prick to prick test. If it's negative, I may do even intradermal test with that, and positive, I can say that this patient has got coloring agent positive. And then we give that thing mixed with the food substance and we will give slowly without his knowledge as a food challenge test. And if positive, definitely this is positive, that is positive. I can say that is maybe the reason for that. But it's very tough job. It is time consuming. Next. I think I feel that in India we are not to give cow's milk so early. In fact, we say that you can wait up to 1 year. I feel that cow's milk. Why you want to introduce cow's milk? What is the necessary cow's milk when there is a good food is available with our good quality of food? I feel that is not required at all. I am telling you, I told you one of the case of PIPs. Still, they are coming to me only. I am telling you, mother, off and on they will be admitted. Suddenly with the dehydration and all, some other place in the nursing home. Afterwards, I get a phone call from the doctor. Doctor, you diagnosed it as a PIPS. I had that how to treat and all. They'll say, mother, I will ask grandmother without knowledge of mother and parent. Now they stopped already because bigger change. This is a big problem. I agree with you. A lot of people. But I will tell you, milk allergy, if you give before 3 days, that is a commonest practice in India is doing. That is the biggest thing what we have to change now pattern of the cow's milk. Why cow's milk increasing? We gone to the study and we found out that thing most of the mothers they give cow's milk or what formula milk, whatever dabba they will buy, or a lot of nursing homes as soon as born, before born itself they give dabba itself by the side of the child milk. That is the cause for the milk allergies increasing in India. This has to be stopped. I feel that. Next. No. Just the person is not eating and is not gaining weight or height. He is not going to suspect at all. Only thing there is any gastrointestinal symptoms, especially diarrhea, recurrent abdominal pain. Diarrhea has to be there for the case of eosinophilic. Either diarrhea or dysentery, both has to be there. Small migration. Don't go for one. Symptoms has to be there, otherwise there is no question of eosinophilia, no question of doing gastroenteritis. More common nowadays, we are seeing a lot of adult patients also. I see a lot of patients. One of my relative also, one of the adult gastroenterologists, we know them very well, phone to them. No, nothing is there, sir. Please take biopsies, 3 or 4 biopsies in the colon, and then we did it. Eosinophils more than 75%. And then good diary we maintained with that lady. We found out that is mainly things gluten. Again, we found out gluten-induced non-IgE mediated eosinophilic gastroenteritis. So this is why I'm telling you it takes its own time. And please understand that thing. You have to work out these are things. It takes long time. Reward. It may not be rewarding for money-wise, but definitely it's got a good reward for the people who are working out. You get a satisfaction for that. Next.
There are some questions by the audience.
Yeah.
Does the food allergy runs in the family?
Maybe. Definitely food allergy, IgE mediated, non-IgE mediated can also run in families.
Usually patients comes and ask if the father is having allergies, if the baby will get the allergy or not, how we can proceed in those cases in the newborns.
We ask them the mother. Newborns, we cannot able to diagnose immediately. We have to go for at least 1.5 months to 2 months. We have to know about PIP and all. We have to know. At a later stage only you can able to develop proctocolitis syndrome or colitis and all. But what we have to do is that family of allergy very difficult to get in India. What we have to do, either family may not have food allergy, but he has got allergic rhinitis. He has got asthma or whatever may be. Atopy signs has to be there. That is very important.
Okay. And there is one question, which lab is better for the blood testing and how we can select the labs?
Whichever lab may be there, IgE is better. There are 3 or 4 labs are doing immunocap testing. That is SRL Ranbaxy, Lal Path, and Lister Metropolis, as per my knowledge. And we are doing ourselves also. Some of the hospitals, the Apollo hospital we are doing, and my hospital also doing. Like that, some of the hospitals are doing. Or in the labs in Bangalore also doing. I know as per my patients who are coming, and we are know about that thing. I think better to send to these type of labs automatically all over the India available, all over the world available labs. You can able to know about that is better. I will tell you one case who has come as a teleconsultation to me few days back from Bombay. Patient is from Bombay, actually from Chembur, I think he is from Chembur. The boy is 1.5-year-old child, diarrhea, chronic diarrhea. Patient was 10.58, come down to 7.58. They are very much worried. Somehow I don't know from where they found, and they have a teleconsultation. I talked to them, and what milk you are giving? Soya milk. Why you are giving soya milk? Then parents are telling that already doctor told me to stop whatever cow's milk is getting soya milk. Soya milk, I asked them to do all the tests. All I know that definitely parents asked me to do, and forced me to all negative. Then I explained to them, this is IgE, non-IgE mediated, you stop it. If it is not improved within 15 days, it is not milk allergy. He stopped it with a child within 2 months, regular consultation with me. Within 2 months, child has gained back to his normal weight. That is very important thing. And we want to ask him now. I told him that you give the milk, either soya or this thing. Patient is come back again or not. We want to find out that thing. Patient is afraid to give the milk. Challenge. He is refusing to.
Okay. There is one good question. How to maintain the food diary and importance of food diary?
This very important thing is food diary, whatever he eats that day. Okay. Time, whatever he eats, what are the ingredients in that food? I took idli with sambar, breakfast. Idli, what is used? What type of dal used? Sambar, what type of dal? What coloring agent maintains? All these things has to be maintained like this. Whatever. And come back after 1 week every time. And along with that, when he developed symptom, he taken idli. Afterwards, so many days afterwards, he developed this abdominal pain that time. Then every time that food is taken after 1 week or 1 month, food diary you maintain, you can correlate with that thing, and we can able to prove that that may be the cause 100%. Then we do the challenge. 2 or 3 things we'll keep it in, and we do the challenge which are positive, we can able to take it.
Okay.
Prasanna.
Sir, you want to ask some questions?
Prasanna,
Yeah.
I have one question for sir.
Okay.
Yeah, there is so much talked about peanut allergy in foreign literatures. What is the Indian scenario about peanut allergy, sir?
This is $1 million question, but whatever I know, I will tell you. Olden days back in India, peanuts are used to boil and eat. We never used to roast. Nowadays, we are roasting. So whatever, if you want to develop any allergy, what happens? You have to have a go on taking. Suddenly, it cannot develop allergy. The epigenetic changes has to take place. DNA methylation has to take place. Only so many generations. This generation may not happen. Next generation may happen or may not. So many generations afterwards, the effect will be there. That is one thing. There is in India, this type of gene may not be there. A lot of polymorphism and all they found out in abroad is not there. Another thing, whatever they are telling. These are the 2 things. Another thing is that peanut is not a nut at all. Peanut is different. And genetically, Western people are more prone compared to Asian people. There are a lot of things are there. They used to use, once a child is born, they apply peanut butter. So many years. That's why sensitization nowadays, allergy is not by inhaling method, but or by injection method. Allergies, most of the allergies happen only by cutaneous method, that is epicutaneous sensitization. That is the reason why peanut butter. Now we are seeing lintel allergies in India, South India, lot of yellow dal they will apply into the child in the young age. That may be the reason why this lintel allergy is increasing. Maybe another 10 to 15 years we can see next generation or third generation, maybe lintel allergy is very, very high. You can see. I feel that is one thing. But
thank you.
Still, There are a lot of work is going on. There is no difference at all between the Indian peanut and that peanut, but our peanut is, I don't know, whatever. You know the thing, the Indians who are stayed, IT industry taught us, the Indians who are gone to abroad and they produce a kid, they develop severe, more than 4 times to 10 times of allergies compared to the ethnic population. The same child, the two, I will tell you, twins. One twin has gone to USA, another twin is India. This twin has produced a child, and that twin has produced another child. They are both times simultaneously. That twin has got a highest severe allergy, atopic dermatitis, food allergy, and all the lentil allergy, all the nut allergies or peanut allergy. This child never develops anything. There are some factors which are protecting the SAARC countries. Still, we don't know. A lot of people, maybe hygiene hypothesis or maybe anything, whatever, maybe a lot of people work is going on in India. Asian SAARC countries have got less allergies compared to them. But food allergies is a bomb. I'll tell you, second epidemic of allergies in India are going to come because Prevalence study done in India found that 0.5% of the people are suffering, but sensitization is 20%. Very huge high. That's why there may be chances of patient may be developed later stage.
There is one question. The baby is getting the allergy if the mother is taken the food. The allergy can be get through the breast milk. This is a common question asked by the grandmothers in daily OPD.
1 in 1 lakh dilution. 1 in 1 lakh patients you may get. Understand? But for this sake, all consensus statement, all societies everywhere in the world, they told that not to stop breast milk for this purpose. Understand? I don't recommend to stop any breast milk for the person. 1 in 1 lakh dilutions causing this type of things. First at all, you must stop the milk, cow's milk, other milks, rather than mother to take. If you want, that also they are not recommending. Mother can stop cow's milk if they want to stop. Otherwise, there is no question of the mother also can take as per my advice. Next, a lot of questions are there here.
Yeah. How can we do the dilution of eating colors?
Dilution and all you have to come and learn. We cannot tell you overnight, over 10 minutes here. It's impossible to tell what is the method we are following and all. These are our own efforts we learned and all. We cannot talk 1 in dilution, 10 in dilution. You may come that Nagaraj talked like that, but when I didn't find any positive. That is not going to come. And how do you do slit? How do you do oral immunotherapy in these forums is not correct.
Right, sir. Yeah. Kulkarni, sir, any question?
There is one more question is there I saw here. Okay. Kulkarni, anything? Hello, Kulkarni. Where is he? He's gone or what?
Hello.
Suhas.
Sir. Hello. No, I have finished with my questions. Now I am handing over to Prasanna if he has any.
Okay.
Yeah. Right now we don't have any questions. So a very nice and elaborated session this was. Thank you, sir. You have talked about the very good. Yeah.
One question somebody was asking: how NSAIDs? Somebody was asking how do NSAIDs and other drugs decrease the threshold of allergies? Is it true?
Yeah, it's absolutely true. Not only for the some genetically prone individual, not all people. Please understand that all people you are taken NSAID, you cannot reduce. You are genetically prone individuals, not that thing. Their NSAID is all NSAIDs, not only one NSAID. One NSAID, aspirin means sensitivity. We check for all NSAIDs, only aspirin. I don't check for all NSAIDs.
But is it a good practice to prescribe NSAIDs for reducing allergies for pediatricians?
No. This is reducing threshold and you develop more allergies. That's only our question is that. Why all people develop? It won't develop, only genetically prone people only develops. Threshold will be reduced. That's why articulated rashes, a lot of people come and say that I am allergic to food, I took this thing. But actually, NSAID reduced that thing. Fever is the cause, or NSAID is the cause, or beta-lactam is the cause. Nobody knows about that. All three drugs are there. And we have to do, whether it is due to viral or it is due to beta-lactamase or NSAID, we do a lot of unnecessary drug challenge tests and all we do. And we found out it is viral. Sir.
One question is, many times we prescribe antihistamines. So for how long we can go for prescribing? Maximum duration.
There is no role of NSAIDs in food allergy if you don't have any reaction. For a prevention purpose. Antihistamine, there is no load. If you got reaction is there, until the subset of the reaction you have to prescribe. But food-dependent exercise-induced anaphylaxis, they found there are a lot of studies are going on. Cetirizine has got some role to play. One, and then montelukast has got some role to play. These are all, I didn't tell you all these things because these are all evaluating types. We cannot go ahead with that type unless consensus statements or some guidelines will prescribe, we cannot go. Like a lot of studies done with probiotics. But no, none of the things has proved. One says that you can use, another fellow says that. These are all studies are guided by some companies. That's one of the reasons why these people not recommend. Until then,
yeah.
I have one question.
Yes.
My son is 22 years old. He's having allergy to all the lentils, chana, matar, chola, besan, last 15 years. What is
actually all cross reacts, that's why all the thing. He's got a lentil allergy.
Yeah, so what are his chances of his allergy going down, or is it going to persist throughout life now?
I think once in adult age, once allergy comes, it will persist for lifelong. Especially lentil allergies nowadays, everyone working on that, it may persist long time. What is the allergy, first of all? Is it IgE mediated, non-IgE mediated?
IgE mediated.
What is complaint?
No, he gets severe urticaria, swelling, periorbital edema, and then he goes in spasm, bronchospasm, if not treated.
That's why better we can able to avoid it or go for the oral immunotherapy or sublingual immunotherapy. That's the best way.
Immunotherapy. Okay.
Yeah.
Okay, thank you.
So someone is asking, how common is poultry allergy?
Chicken allergy or egg allergy? Poultry indicate both.
Yeah.
Chicken.
Chicken allergy is very, very rare. I always tell that I didn't put you this thing question. One of the questions they asked me when I was in one of the TV program is giving, live program is going, somebody asked me, I eat egg, chicken, I develop all allergies. When I gone for the checking, doctor has checked you, yourself has checked, he told me like that over the phone, over the meeting itself. I didn't have anything at all. You told him, no problem at all. But still I developed. What is the problem? He asked. Then I told that the coloring agent is putting red color agent. I told no, avoid. That is the cause for the allergies. Red color, caramel is the red color. That's why red color caramel applied over that thing is the main cause for allergy, which is the commonest allergies. Chicken itself is very, very less. That's why we tell patients with milk allergies patients, we use chicken-based milk, that is neogain feeds we use normally in most of the patients. That is chicken-based milk we give because of that one. And mutton also, a lot of patients are developed, but chicken is very less allergy, like rice is less allergy in India as far as India is concerned. Egg allergy, of course, we are getting egg allergy.
Someone is asking, before doing IgE levels, should we stop the food or we can give?
No. If you want to do IgE levels, you need not to stop that food. You have to continue to do food. And you have to continue. Then only positivity will. You stop for 3 months and do, levels will come down also. Naturally, it won't be sensitized.
Yeah.
Sir, I have a query, sir.
Yeah.
So as you said that we should, it is recommended that before first 1 year of life, we should avoid cow's milk.
Yeah.
So what about the giving, once these parents give tea, they give tea, yes, tea, which is contains the cow's milk. Isn't
okay. Please tell me.
can we go for it or not? Should we offer tea before 1 year or not? Because it also contains the cow's milk. It's my query, sir.
So cow's milk allergy patients, I don't advise tea with the milk also. If you want to give tea, but I feel that if you want, in now latest thinking in foreign countries, you can start milk by 6 months of age. In India, we are not allowing. That is biggest problem. What is that? But if you want to give tea and they are very perturbed, if patient is not having allergy, you can give after 6 months or 7 months. Patient able to drink very well, you give. That's only in foreign countries they say that a swallowing capacity is good. You start early milk only. They are telling foreign countries. But in India, we don't allow. We follow the WHO policy. 6 months afterwards, you can give. You cannot able to do anything. You can give exclusive breastfeeding only. 6 months.
It's the same, sir. One more thing. What about the formula feed during the first few days? As much as noted that few mothers, they are a bit reluctant or they can't feed their babies with one excuse or other. Then they give the formula feed. What the formula feed during first few days of life?
That is the only thing. That's why our cow's milk allergy is increasing all over India. I am telling you, first 3 days is the main cause. Formula feeds are cow's milk. Whatever feed may be, feed is feed only. In first few days, in some other place they give donkey milk. You know that thing. They will like a donkey. Patient, he will be lifelong. Will be with him. That is why the people believe also. Some other places. I think a lot of questions has come here. I think Shishir, you can see.
Yeah. Someone is asking any fallacies of specific IgE tests which may need to be avoided. Like how many days after steroids, if given?
I think steroids or antihistaminics or skin condition all won't affect at all. There is no fallacies at all. We can give, only cost is very high. And the thing is, you have to do continuous calibration of the machine. Machine is not calibrated, you will get wrong results. And it is not, even if I say by phone, please change the thing. A lot of people olden days they used to tell fever has come 7 days. You tell to the laboratory, they say that we give as a typhoid. You give treatment as a typhoid like that. You cannot change here. Machine generated everything. Once you feed inside the immunocap machine, automatic result will come. It is not in your hands at all. There is no thing. Only thing is, if something wrong, machine will tell, no, it is wrong. Something I cannot take. That's the only way it happens. There is no policies as such. That cost is very exorbitant. You have to maintain the calibrations and all. You have to maintain that.
Yes, sir. One practical question somebody is asking: which centers are doing immunotherapy?
Which were food allergies or aero allergy immunotherapy? In India, food allergy, we are the only people doing. Nobody else is doing. We are doing for gluten and we do for the milk. That is the commonest cases in our country. We are doing a lot. Yeah. Our results are much better. We are already focus ourselves in European countries also. But otherwise, food allergies, even now I am telling you, milk, you have to get, there is separate antigen for that. Same milk you cannot put in that, patient will die immediately for anaphylaxis. You have to develop you have to work with the center where they are doing. Both let something come back and learn. That's only. Just don't start without knowledge of the food immunotherapy, how to do and all. A lot of people started asking the questions, how can I do? Can I start immunotherapy? Can I do sublingual immunotherapy? Can I do? You will develop a lot of problems. And patient will be in trouble because these are all not FDA, not is approved by the DCCA. That is only taking consent and doing. That's why you have to be very careful on this. Unless you know the protocol, proper protocol, you cannot do.
Yes, sir.
And
yes,
one more thing is coming. Where is the immunotherapy? pre-risk for SPT. I think pre-risk with SPT is IgE. IgE mediated disease has to be there, otherwise you cannot do. And another thing is that it cannot be, skin must be properly, and patient cannot take antihistaminics, and there is no dermographism. A lot of things are there. That is, and hello,
Hello.
it is gone.
Yeah, yeah.
Something is.
No. Somebody
You can able
shared.
to listen. No, that's okay. No problem. Any questions? Otherwise,
I think there are no questions right
Sir,
now.
is there any?
But it was a very interesting and lucid discussion, sir. Everyone is still willing to go ahead, but well, because of lack of time, I think we are constrained. But we are hoping that we will have one more elaborative session hereafter. Especially a few of our members were interested in immunotherapy, sir. So
okay.
we will definitely arrange one more session, and we can
I
send.
think we can do it in November or December because I am very busy with the elections of IAP. That's why.
Yeah. I know, sir. You are contesting for vice president. South. So we are your well wishers, and we need a leader like you as such passionate personality, doing great work, and that too for.
I want to develop the allergy immunology. I am trying my level best to India. Everybody would learn more and more about it. We are trained. I trained 102 people up to now under me.
Yeah.
Those who learn. And now also I am doing online course. 30 people registered now. Every day I take two hours class. And my wife shouts me, you take 2 hours class, and also you talk in the night 4 or 5 hours. What happened to your throat? Every day you're working like mad.
No, you are a very passionate personality, sir. Really nice to see you and hear you, sir. And we
Thank you
for your future.
Cecil, I am very happy to see you after a long time. Hope so. COVID will go out, and I will come to Kolhapur and spend some quality time with you all people and see the goddess Mahalakshmi, my beloved goddess. I like you. I was with you. You saw that devotee, and I'm devotee of that, and great deity I saw, and very thankful to you all the things. And thankful to IAP Kolhapur, especially Prasanna, you, and where is Suhas is missing. Suhas, all these things. Thankful for all of you, for IAP Kolhapur, and nearby branches also might have joined. I saw some people's names. Thank you very much, sir, for giving me this opportunity.
Thank you.